county jail. The prison band was there, they began to wail. The band was jumping and the joint began to...
Hi, how are you doing?
Oh, I've been alright. How have you been doing?
You've been well.
Well, I just came because I've been having some pain lately.
Explain some of your symptoms to me.
Well, I've been having some pretty bad headaches, and I never get sick, but I've been vomiting lately. And I was driving the other day, and all of a sudden my vision just seemed impaired, and I don't know, it was really scary.
Do your headaches worsen with activity?
Yeah, when I work out, I can hardly keep my head up.
Okay, I would like to run some tests.
What kind of tests?
Well, I want to start with a concussion test and take your blood pressure. And we will progress after that because your constant headaches and rare vomiting could mean something serious. Are you on any specific medication?
No, not other than the occasional aspirin.
Okay, let's start with the test now. I'll get back to you within the next week with all of your results.
Okay, sounds good. Hey Doc, hope you got some good news for me.
Well, your concussion test and blood work came back normal, so that is good news. But your CAT scan and MRI were not as good as we hoped. I'm so sorry, but with your symptoms and the results of the CAT scan, we concluded that you have a brain tumor in your left cerebral hemisphere. We don't know if it is cancerous or not, but we will refer you to an oncologist that works with your insurance agency.
So you're telling me that I have cancer? Are you sure? Shouldn't I get a second opinion? Or could the test be wrong?
I hate to tell you this, but the test is conclusive and you have a tumor. We will send you to an oncologist for the further diagnosis and treatment. You will need to meet with your insurance agent.
Blue Cross Blue Shield, this is Kirsten.
Hey Kirsten, this is Maddie Schaefer. I'm kind of lost right now. I was just told that I have a brain tumor. I need to contact you to find an oncologist, and I don't know how I'm going to pay for all of these expenses that are going to entail.
Oh wow, I'm sorry to hear about that. Well, your HMO will cover most expenses after a modest copay, but it limits your choice of providers to those within our network. I'll forward you a list of approved oncologists so you can choose the one that you favor. Your HMO may not provide coverage if you receive healthcare services from a doctor, hospital, or other healthcare provider outside our network, and we need to refer you to the oncologist that you would like to choose. I'm sorry again, I hope this works out for the best.
Hi, I'm Kayla. Nice to meet you.
Hi, I'm Maddie. My insurance agent referred me to you as an oncologist, so I guess this is what we're doing.
Well, I'm sorry we meet like this, but I did get your results from your family doctor, and we'll have to look into this because the MRI and the CAT scan did show a tumor, and we'll have to look into that. But the blood work seemed fine, which is good news from other diseases. But we'll get you a biopsy to determine what tumor it is, and that won't be very invasive. It'll be a pretty easy procedure.
Okay, well, how serious is a biopsy?
It's really not that serious. We can get it done tomorrow, and I'll get the results back to you in a week. We can determine where to go from there in terms of treatment. We'll probably get you on chemo at some point to help get all the to radiate the cells and get those killed.
Okay.
Alrighty, can I have your insurance agent's number? That way I can call them and meet up with them.
Yeah,
we can
sure.
all meet up together, and you can ask any questions you might have, anything like that.
So we'll have a conference sort of thing with you and my insurance agent?
Yeah, I'll be in touch with you on that.
Oh, wow. Okay.
I'm really sorry.
It's okay.
Can I have her number?
Yeah.
Blue Cross Blue Shield, this is Kirsten.
Hi Kirsten, this is Dr. Carter from UT Medical Hospital. I met with Maddie Schaefer. She said that you are her insurance agent, and I just want to talk to you to figure out what kind of insurance things we can talk to her about and get her helped out with that, because it turns out she has glioblastoma cancer, which will be really hard on her. And just wanted to see if we can meet up, and I'll probably do a chemotherapy and a surgery, get her on some steroids and some other medication to prolong those chances and help her out. But yeah. Could we meet up or something?
Yeah, we can actually meet up Monday at 3 at Blue Cross Blue Shield. We have a conference room if we all just want to come there.
Alrighty, sounds great. I'll contact Maddie and we'll see you Monday at 3.
Hello.
Hey Maddie, this is Kaylee getting back to you. I set up a meeting at 3 on Monday with your insurance agent at the Blue Cross Blue Shield conference room. So if you go there, they'll lead you right there. We'll be there to answer any questions, get you some treatments and some prognosis, and if you have any family trouble and like that, we can help you through that. So is that cool with you?
Yeah, that sounds good. I'll be there at 3 o'clock. Hey guys, before we start, I just want to tell you that I'm starting to accept all of this, and I don't want you to sugarcoat anything. I want you to tell me straight up everything so I get the most information that I can. And I have some questions, and I am kind of still lost with all this, so try to do this the least painful way we can.
Yeah, for sure. Okay, so we got your test back from the biopsy, and you have a glioblastoma, which is a cancer in your brain. The cells are like kind of like star shaped, and then they're hard to get all the way out with surgery just to remove it.
So what are we gonna do if we can't remove it with surgery?
Well, we will go in with surgery and get as much as we can out, and then we can stick with chemo and any alternative drugs and like steroids to help kill off all the other cells that are like kind of like spread out throughout your tissues and everything like that. And we can start with that, and she'll give you all the financial help that she can with that kind of thing and make it as easy on you, and we're just here for you too. And any questions, anything?
Well, when we were doing these treatments, is the goal of the treatments to eliminate the cancer, or are there gonna be any to try to take pain away?
A lot of it will get rid of your cancer mainly, and that'll help with like your lifespan, and it'll also help with your with a lot of your symptoms. But the chemotherapy will that can cause a lot of headaches and some hair loss and nausea. Really, fatigue is also a major thing. But if it's serious, you don't have any if you don't have a really bad reaction to it, we'll get you off. Like the worst is like seizures or something like that, and that's really rare, and we can get you off that easily and change your treatments. But that's what we're looking at right now.
So those are the main side effects?
Yes.
Okay, and when is this treatment going to start?
We can get you on chemo we'll start that after you start recovering from the surgery. It shouldn't take too long to start recovering, but the surgery will be one of the most effective ways to get the cancer out.
Okay, and I talked to my insurance agent a little bit, but we didn't know what sort of treatments I was doing yet. So with knowing that I'm gonna do this radiation and all this, what is this gonna cost me with my HMO?
Okay, so radiation cost ranges from about $1,700 per treatment to about $16,000 for 4 treatments. Since you have an HMO, you're going to have to pay a little bit on the $16,000 because you're going to need about 4 treatments, right?
Mm-hmm.
So you're going to have to pay a little bit, but your HMO will cover most of the costs.
Okay. Well, I guess.
Well, how are you doing with this? We can set you up with any grief counselor. Have you talked to your family or anything like that?
I started talking to my family about it, and I think that we're starting to look into getting a grief counselor because it's hitting everyone pretty hard.
Yeah, well, I'm really sorry, and we're always here for you. We're here to help get this out, and we'll be there.
And if you have any financial questions, feel free to call me anytime.
Thank you very much, guys.
Thank you.
Alright, so you guys said that it's really hard to remove all of the tumor in surgery, so let's say that you remove as much as you can, then we think that all of it's killed off with the radiation and chemo. Is there a chance that it can come back and after we already think that it's gone?
Yeah, glioblastoma is one of the more serious cancers, and it has a really strong chance of recurring if it's not all the way gone in the first place, especially, and it'll stick with you for a while.
Okay. I know this is one of the most common questions. It's kind of blatant, but how long do I have to live?
Well, with this treatments, it'll really help you. It'll change. It'll increase you from about a year to at least 2 years. 30% of glioblastoma cancer patients live up for 2 more years, and then 10% will live up for 5 more years. So we should really look into a grief counselor, and these treatments will take seriously and go hard at.
and chat with you for a little bit now that we've figured out what I'm gonna have to do.
How are you feeling?
I'm a little nervous about everything, but it's something that you just have to accept now, I guess. I'm just trying to deal with it and deal with my family in the best way that I can.
Have you started treatment yet?
No, I'm starting this week though, and it's gonna be hard to adjust to everything, I guess.
Are you scared?
Honestly, yes. Can't tell anybody that though, because I seem like I'm the strong one since I'm trying to be there for my family more than they're here for me, I guess.
Yeah, I understand. So, like, are you gonna be able to still participate in like normal activities?
They just told me that I'd have a lot of fatigue and I would feel tired and maybe like lose my appetite, and I'm gonna try to act as normally and live the most normal lifestyle that I can, but it's gonna be hard with the symptoms and the responses that I get from the different treatments.
Is everyone supporting you well?
They're trying their best, doing the best that they can. It's hard to adjust to something like this.
Yeah, I'm sure it is. Sorry you have to go through this. You know, if you ever need anything, to call me.
I will, definitely. Thank you so much.
You're welcome.